not about quality improvement necessarily, but this is much more about safety. Someone's left their lights on. So it's Volkswagen Jetta, license plate BBAZ170. Is that somebody here?
Yeah.
Yes, there you go.
Yes.
Oh, great. The first quality improvement process that I need to personally actually implement is to make sure that I actually print my slides so that I don't have to stand backwards. So at least I'm going to try and do that so that I don't have to. So I am really excited to be here and to have such a full room of people that are really, really interested in making a change for the patients and the clients that we care for. So it's a pretty exciting day. We are linking today, and the whole learning collaborative, as Kelly said, to quality improvement. And for me, it's really about making changes that actually help that patient and their family, or the individual and their family have better quality of life. Maybe it's a better end of life, but it really is about changing the work that happens with that particular patient. And of course, in order to do that, you need everybody and their brother, all the different stakeholders involved in that. And so this is the Health Quality Ontario, actually Quality Improvement Framework. I'm just going to pick up on a couple of the points from this, but really it is about figuring out what the problem is, testing some different solutions to see if that's working, measuring along the line so you know whether it's working or not working, and then figuring out how to spread it. So we're at a couple of different places today, but a lot of today is about spread of a coordinated care plan. But I'm going to take you to where we're at overall in the Southwest. You guys are way ahead of lots of the rest of the places. And so the first piece is actually understanding what the problem is. And behind this statement is a lot of data and a lot of understanding, but ultimately it is that the people who are frequently having to go to the emergency department or be admitted to a hospital are likely not having their healthcare needs met in the best way possible. And so it is about figuring out how to care differently and potentially not have them have to rely on the hospital to the same extent that they are currently. And so out of that, and I have to read this because it's one of those statements where we try to get all the right words in. So it is to reduce avoidable healthcare utilization in order to better meet the needs and support individuals and their families with the greatest healthcare needs in the South West LHIN. So that's our whole goal statement across the Southwest. And honestly, this is being measured at this point in time by the amount of emergency department visits and the amount of hospital admissions. And so those two pieces are the key measurements behind this statement. And you can see at the bottom of this particular slide where it says that we're going to actually make a difference in these two measurements. We need to chart this over time, and you'll hear more about it later this morning, but really give a shout out to some of the people in Perth who have really started to track those people who have had a coordinated care plan and are actually making a difference in these two measures. And so it's just a little teaser for later. Locally, all of you in the room either belong to the Here in Perth Health Link or the London Middlesex Health Link, and those people like myself just ride along. So I'm pleased to be with you today. And in all of the work that you people have done around getting here, some of the common problem statements that are coming up in your paperwork are that we often, as providers, are working independently and not understanding across the whole system what the patient goals are and being able to communicate that in a really good way. And we've also, as I said, identified that, and we've identified it across the Southwest, but you also have in both Here in Perth and London Middlesex, identified that there's higher emergency and inpatient hospitalizations for patients, like today when we're studying COPD.